It's a pleasure to welcome Dr. Mohammed bin Atif to the YSA Conference of 2025. Dr. Mohammed graduated from Dow University in 2022 and is currently an internal medicine resident at University of Pittsburgh Medical Center. Alongside his strong academic achievements, including an impressive Step 2 CK score, he has shown deep dedication to service through his work with medical camps in Karachi and street medicine at UPMC, providing care to the underserved communities. We're truly honored to have him here with us. Dr. Muhammad, the floor is all yours.
Hi, good morning. Good morning. Thank you
Hello.
for the introduction. Thank you, YSA, for having me. It's great being here. I just want to preface before I start with anything, without before I start my talking points. I just want to let you guys all know, as I told Zafira beforehand as well, I was actually backup resident for the week, and I got pulled in this morning for a weekend shift. So I am actually carrying a flex pager, which means this little thing, if this starts beeping, then I will have to go because a rapid response will have been called on a patient, and I carry this godforsaken little device over here. So I just wanted to let you all know that. Please excuse me if I have to leave abruptly for some reason. I hope not. But yeah, I just had to let you guys know that I do have somebody that I forwarded Zafira a contact if something like that does happen. There is somebody who can fill in for me. But yeah, that's about it. So like Zafira said, my name is Mohammed and I went to Dow University in Karachi, and I am now doing my internal medicine residency here in Pittsburgh at UPMC. Okay, so I believe the first talking point that I am supposed to talk about is getting into med school, insights on building a competitive application. So I'm not gonna lie to you guys, it's been like a million years since I got into med school and left med school. That was way back in 2016, and I went to high school in Saudi Arabia where I did my A and O levels, and then I went to med school in Pakistan in Karachi. So it's been a hot minute since then, and it's been a really long time. But from what I know, just generally, like things over here in the US work differently when trying to get into a med school. People over here have a more holistic approach with things. You know, they're trying to focus not just on your scores, but they want to see your extracurricular activities. They want to see your volunteering activities. They want to see your community outreach. It's not just about just having the best scores in this part of the world, at least as far as from what I remember getting into med school in Pakistan, is unfortunately it's still just more of a rudimentary process about having good scores and having an MD-CAT. So I don't know if things have changed over there much. It's been a while since I've been over there, but that's what I remember. Standing out in interviews, I recall Aga Khan was one of the few medical schools that actually had interviews, and over here, interviews are a real thing and part of your residency process as well. Interviews, listen, I just want you to know, once you're selected for an interview, the general trend, not just in residency, as far as I remember in med school applications and stuff, is also once you're selected for an interview, it means they're done looking at your CV, they're done looking at your scores, they're done looking at your application as a whole. Now they just want to get to know you, and I want you to be. I always recommend any person to just be themselves in their interview, to be humble and to just be open to feedback. Show yourself, give it a personal touch, let the people know why you would be a privilege to have on their team, at their med school, at their institution, at their residency program, whatever it is. So you just want to shine, you want to show your personality traits, you want to show what you bring to the table. That's all. You don't have to just go on and on about your academic achievements and your extracurricular activities. You just try to give it a personal touch as far as, I mean, that's what I do and that's what works for me. Surviving and thriving in med school. Okay, so I honestly think med school is like, I know we all have our problems with med school, and it can be very challenging to juggle at times with work, especially we're in a kind of field where most of us have to, at some point, we have to for abandon some family events, some family weddings, some friends party or something because of exams, because of quizzes, and I know that's tough to juggle with, but honestly, at the end of the day, I think if you're just it's not that
Mm,
bad. Sorry. Okay. It's not that bad. It's not that tough. Look, you just have to you have at least as I don't think is this just Pakistan? I don't know. I think this is for all over the place. So but
It's for all over.
it's for all over, right? Okay. But listen, like your first couple years, you're not I don't at least think you should be feeling the weight on your shoulders to like prove yourself and do brilliantly and have stellar scores. Honestly, your first 2 years in med school, I think, are just you trying to figure out, trying to set your own pace, trying to find whatever works for you. Because remember, everybody's going to have a different method of studying and keeping on top of exams, staying on top of module tests or professional exams or whatever you have in whatever part of the world you're at. You have to take things slow and just try to find what suits you. Listen, and just remember, all all work and no play makes Jack a dull boy, right? So I don't want you to just be constantly on the grind, constantly studying. You got to figure out your own pace. You got to see, mix and match what kind of study strategies work for you. I know a lot of people who would say they're visual learners, and videos, audio recordings or videotapes like DNV resources and Kaplan, those worked out more for them. For me, I preferred reading because just reading was always a thing for me where I grew up and stuff. So I preferred reading long books, Robinsons, and all of these kinds of. But everybody's gonna be different. You can't compare yourself to different people. You have to find what works for you. You have to just make a balanced schedule, a balanced time to study. Was sometimes some people what I would see would just work 1 hour every day, but that consistency gradually would build up, and that just 1 hour of study every day up until professional exams or whatever modules was adequate preparation for them. Some people would not study in the first couple of weeks of a module and then just absolutely go ham, crash on the last 2 weeks and study really hard in those last 1 week or 2 weeks. Everybody has a different methodology. Personally, what I would like to do is just I would just set a timer for 1 hour every day from the start of the year, 1 hour, 1 hour and a half. And I would just know that, okay, I know this topic is part of the syllabus and I'm just going to do this one topic today. Tomorrow, I'm going to do another topic. I would just break it down and make it very small, small, small so that, it would have a cumulative effect by the time exam season was around. So I wouldn't have so much burden on me because I just don't work well under pressure, I guess. I don't know. It's everybody's different. I saw people who have succeeded brilliantly even after like just chilling the first couple months, and then the couple month or so just before exams they would just crash, like 8 hours a day, 2 hours, 7 hours, whatever, and it worked for them. So it's all about finding your own pace. Everybody's going to be different. You don't need to compare yourself. Overcoming imposter syndrome, right? So self-doubt, so this is something that a lot of, I guess, us medical students maybe we face. We all have this moment where we are thinking, am I good enough for this field? I think it less so happens in people who actually knew, like I was somebody who knew I wanted to be in medicine from like really early on. However, that's not to say that because of the rigorous training that you have in residency and just the process of getting in residency is bound to create some doubts in you. But listen, I personally think for you to slightly doubt yourself at times as a physician is never too bad of a thing versus on the flip side, a person who's overconfident in their abilities. It's you shouldn't be so underwhelmingly afraid of yourself or doubting yourself. However, at the same time, a good physician is somebody who constantly questions his decisions and constantly questions if he's doing the right management protocol or following the right treatment plan, and is never afraid to ask for help or ask for feedback. I don't think there's anything wrong with doubting yourself. I hate working with people who seem to be so confident, so sure of their abilities. Those are often the people who end up causing a quality improvement project for us in residency programs. So you don't want to be that person. You don't want to be overconfident. But yeah, at the same flip side, you can always be questioning every single thing you do. But at the same time, I'm just trying to tell you that doubting yourself a little bit here and there, feeling overwhelmed at times is perfectly normal. And it just shows you have what it takes to be a good physician. If you're not afraid to ask for help, if you're not afraid to ask people, where did I mess up? Am I doing something wrong? Am I supposed to be in this field? And hopefully, if you have a good support system like I do over here, and I try to provide for my juniors in general, uh, you will get the reassurance that you need and that you should have, because self-doubt is something that is perfectly normal for you to feel. As a physician, as a med student, I don't see like uh, there's nothing wrong with that. You should just have a good support system, good people you can rely on, know your friends, know your seniors, know who you can reach out to, and know who you can ask for help unabashedly. So there should be nothing holding you back when you have a good support system. I apologize if I'm talking too fast. I'm just trying to make sure I cover all the points before something might happen. I don't want to jinx it. Anyways, okay, preparing for USMLE during med school. I apologize. I didn't have much time to actually go over the entire itinerary. But anyways, med school and USMLEs. Okay, so yeah, it's obviously it's good the sooner you start out your USMLE journey. However, I just want you to let you guys know that personally, I did not know that I was going to go down this path. I only literally fully committed to it after I graduated. I was like, honestly, I studied and I did well in med school, but I also wanted to enjoy and just like make memories, because I knew that's just a carefree time that you're not going to get back. So I don't judge people if they want to try to like also enjoy the pros of being in med school. Listen, you're only going to enjoy that part of your life just once. You're only gonna get that carefree, no responsibility part of your life just once. And I wanted to enjoy it as well. So I was not just gonna lock down myself really early on. However, I do know people who start as early as third year, fourth year, they give their step ones. But I just want you to know everybody has their timelines. Everybody starts at a different point in their lives, and people end up matching. People, all kinds of people end up matching. They say all it takes is one interview to match. So it's whenever you want to start, you can obviously it's better like if you're really like locked in, if you know you want to do something super competitive like surgery. I wasn't sure if I wanted to do surgery, so that's why I was just like, I'm gonna take it easy. I wanted to go into a medical subspecialty. So, but even then, my plans were actually early on were more focused, geared towards plabs and going to the UK. But I guess just situations changed and some family stuff happened that just made me say, okay, I think I have to do the USMLE. So I made up my mind during my second or third month of house job, which is a basically intern year after graduation. So, sorry, yeah, so that's when I made up my mind, and it worked out pretty well for me. I took about a year and a half or so after graduating to give my steps, and then I ended up matching. So there's nothing wrong with that. There's three main aspects to your residency application. There's your scores, there's rotations, electives, observerships, whatever you want to call them, and then there's research. There's very, very few people out there who have a perfectly well-rounded CV in which they tick all three of those exceptionally. They have exceptional scores, and they've done electives at MGH or whatever, and they have brilliant research. There's very few people out there. I would just suggest pick whatever is your passion, whatever is your strong suit, and try to focus there. Like me, I knew I'm good with studies. I knew I could do well on scores and stuff, so that's what I wanted to focus on, and I gave my time over there. I gave my due diligence, and I did well over there. Some people, they're just not good test takers. That's perfectly normal. If you're like that, you find yourself like that, then try to get into more research projects, try to get a poster publication, try to get a case report done, try to get some sort of quality improvement project in wherever, whatever hospital or place you're working at. Some people get really good electives. That's fine. So you just got to find whatever is easy for you, whatever is you're more passionate about, whatever you what pick a part in your CV that you want to start building early on. It's never a bad thing to start thinking about these things as early as you can. I know a lot of people who gave their step ones in third year and fourth year, and it's very easily manageable. I know it sounds tough, but it's actually not, because in first year you're studying the basics. You're doing pharmacology, pathology, integrate pathoma videos in there, integrate B&B with step one videos. Even though you're not going to give step one in first year, second year, I really wouldn't recommend anybody giving step one so early on. Third year is better, fourth year is better. But you can start trying to, like, delegate tasks, start really early on in inculcating, the general resources, right? There's BNB, there's pathoma, that these are like goated, like absolutely essential, like parts of your USMLE journey. And then there's first aid. Start reading first aid as early on. Every time you're doing a module, let's say you're in where I went first year had a blood module. In first year, we had blood module. I think we had anatomy, upper and lower extremities over there. And I think we had CVS physiology, pharma, as well as respo. So when you're doing those modules, just start early out. Just watch your B&B videos so that whenever you actually get into the proper studying mindset, which is probably going to be in third year, which is what we call your dedicated phase of study or whatever, you want to not be like in unfamiliar, uncharted territory. You want to know a little bit about what you are going to be studying, right? So if you've already watched those videos once before, if you already know what first aid is like, if you're already using Q banks like UWorld or RX or whatever, it's going to make the journey or the process a lot smoother when you actually dive into it in dedicated phase. So just try to, just like I was always somebody, I would just like to always just like delegate things, just like okay, I think I got muted. Is my time up? I'm not sure if I'm over time. Anyways, but yeah, so like when you're doing cardio in first year, you do it, you read all the resources that USMLE is, that will benefit you in your USMLEs, first aid, pathoma, BNB, all these things, and just target it, compartmentalize. It's gonna be a lot. I'm sorry. I think am I running out of time? I keep hearing
No,
other
no,
people.
you can go ahead. No problem.
Okay, yeah,
Now
so
you can start taking questions.
right. Okay, yeah, we can take questions. Are we
Uh,
taking
yeah, sure, we can take questions right now. So
okay.
someone asked, what exactly is STEP? Do you want to talk a bit about that and the exam pattern?
Okay, so STEP is basically the exams. It's colloquially known as like step one, step two, and step three. These are the three exams that are part of the United States medical licensing exam. So if you want to do residency in the US, if you want to go through training over here in the US, you have to do these USMLE exams. Step three is not mandatory prior to matching. Matching is like meaning that you got into a residency program in the United States. So you need to have your step one and two done in order to apply for the application season, which always every year begins around the 24th of September, I believe. So prior to that, you have these two exams. Step one basically covers your is the first exam in the process, and it's an 8 hour long exam that usually covers your basic fundamentals, which is the first and second year of med school, essentially, which is physiology, biochemistry, pathology, pharmacology. These are like the main ones. You do have other modules as well, obviously, but these are like the core essential ones. They really just touch on to what is your first and second year of med school, essentially. That is step one. So it's actually like it covers all the foundational concepts, anatomy as well, histology, embryology, all that kind of stuff, right? All the good stuff from first and second year. So that's step one. And then step two is basically it's 9 hour exam, which is a score-based exam. Step one is just pass fail. Step two is a score-based exam. That is usually that covers in our part of the world, in like South Asia, is your third, fourth, and fifth year of med school, which is to say that you're diving more into clinical medicine, clinical, some aspects of surgery, gynae obs, pediatrics, and psychiatry. Those are like your five main things. You have far, far less. However, there is obviously some degree of pathology, biochemistry. It's more clinically oriented. It's more of a, it's literally called 2CK, which means two clinical knowledge, step 2CK. So that's what it is. And it's a score-based exam. It's getting more competitive, I know, because since step one has become pass-fail, people try to have an augmented score in step two. So you can do step two, and then you apply for residency in the United States. And then it's always better if you have your step three done as well. We can get into that. Step three is a 2-day exam, and that is step one and two combined with a lot more of research in it, actually, a lot more of questions related to like research. I don't know how to, I forgot the exact word that we would use, but more ethics, more research-based questions, more study case reports, stuff like that. So
Yeah.
that's what it is.
I actually had a question. You mentioned research, right? You mentioned research, USMLE, all these things that we have to handle. So, do
Mhm.
you have any tips on how to take all this along with our med school studies? Because those are quite tough on their own, right? So, we have
Research.
to manage research and prepping for the USMLE. Did you make a schedule and fit your personal life as well as all this into it? How would you suggest med students go about managing everything?
So, like, I would definitely suggest that before you get into research, listen, in residency, research is important, definitely, especially for the more competitive residencies. Like, if you want to get into surgical residency or something, which I know this platform is more geared towards that, yeah, research is more important over there. However, keep in mind, you can match without research, and you can match with just the most basic, most fundamental research. What you can match without, and I want you to prioritize when you start this USMLE journey, you should prioritize, right? You need to know it's impossible to match without step one and step two. You're not gonna get anywhere in the residency process without these two things. Electives are really, really important, right? So I generally, what I recommend for people is, if you're really serious, if you know you want to do USMLEs and stuff, why don't you do your one as early on as possible so that you can do good electives? Because when you get into this part of the world, if you know you're going to do USMLEs and you get into this part of the world and you start doing electives over here, observerships over here, I wouldn't recommend in your third year, but possibly end of fourth year to fifth year is usually a good time to do these electives and observerships, because the most programs over here generally say they want your electives to have been within the last 2 years before applying. So end of fourth year, fifth year is a good time to do your electives. And when you get over here, you meet people, you meet attendings over here, you have more opportunities for research, you get to dive into that more. Spend your first 3 years just solely building on your clinical knowledge, build on your foundational medicine, because I promise you that is going to help in your step one. The better you do in step one, the better your step two is going to be. Focus on your studies in your first 2 to 3 years, I would say. Don't think about research up until like fourth year or something, because you don't even know medicine well until you're done with third year. So like, what are you going to do in research, honestly? Research should come
Yeah,
like
makes
down
sense.
the line. So that's what I would recommend.
All right, we have one more question. How can students stand out during rotations or build connections with their residents or their doctors?
So like definitely this is why I say, like, if you build on your clinical knowledge before getting over here, and your physicians, your attendings are bound to ask you questions, you answer them right, you're gonna make a good impression, especially if you've just done your step one and then you go into your rotations. That's gonna really help you, because then whatever questions they ask, you'll not look like a total, like, I don't know anything. So that's one way. But second, the more important thing is, I would say, just have a really good attitude. Honestly, nobody likes an overconfident, a pompous person, know it all, whatever. Just be humble, be kind. People really value that over here. People like when you are open to feedback. People like when you ask questions. People like when you show a good, positive attitude, when you're not full of yourself. So just be nice, and people really reciprocate that over here mostly. There's not much of a general trend anymore about pimping out a student and just asking him a bunch of questions and just putting him on the spotlight. Just have a good attitude, show you're there to learn, show that you want to learn, show that eagerness. And I promise you, it worked for me, it's going to work for you. You're going to build good connections like that.
Yeah. Another question is, how much time does a third year student ideally need to prepare for the step one?
Okay, so this is a very this is a loaded question. How much time do you need to prepare for step one? It honestly it varies. It really varies. At a minimum, you would need 3 months. Okay, it all depends on how well you know your foundational science subjects, meaning biochem, physiology, anatomy, pathology. It all depends on how well you know that, how much of your question bank you do. But generally, the trend is about 3 to 6 months at the minimum. It took me about 6 months because like where I went to med school, we really, and in the part of the world where I went to med school, you don't really focus as much on your foundational sciences as much as you do on clinical sciences. Your third, fourth, and final year, which is very heavily based towards clinical medicine, surgery, gynae obs, that is what we're taught to like focus on. So it took me a little bit of time. I had to like spend do the question banks. Obviously, you don't have to finish them because keep in mind, step one is now a pass fail exam. It's not that hard, but people are taking advantage of it. At the same time, I do see that the passing trend is dropped down to like 88% in IMGs because people underestimated being a pass fail. But you don't need to spend as much time on it as as you would have before. But I would say 6 months is a very, very reasonable time to get it done. 6 months is really, really good amount of time. And you can keep your last month or last 2 months last month, I would say, solely dedicated where you're studying about 6 hours every day. And your last month is when you're just doing your steps. You're not doing anything else. You're not bothered with your med school, not bothered with your house, home, family, with friends, with a life. You don't have a life. You just have step one in your last month.
Yeah,
So,
carrying off of exactly that, right? We don't have a life.
yeah, and
Someone
that one
actually
month.
asked that. They said, how should we manage all this overwhelming state of emotion when we're busy with exams, we're busy with researches, we're busy
Everything
with
seems
step
very
prep?
overwhelming, and we often wonder whether it's all worth it missing out events with friends and family.
Yeah,
Sometimes there's this kind of FOMO. Listen, this is exactly why I didn't start my USMLE journey during med school. I started all of this the day I graduated. That's when I was like, and I was actually doing my house job, which is my intern year back home in my home school country. And but listen, there's no easy answer to this, but that's why I generally, I don't know. For me personally, I know a lot of people are going to disagree with me, especially I know this is YSA, so this is a surgical, everybody's really on the grind really early on. But I don't know, I kind of feel third year is also a little too early. I would always say to give your step one and fourth year, fifth year. If you want to enjoy, you want to take things slow, there's nothing wrong with that. Listen, people match, and there's different statistical rates, but around I think a decent amount of 50 to 60% of IMGs do match. So the odds are not stacked against your favor, right? The odds are kind of in your favor. It's not a bleak and it's not very poor outcome kind of thing. You should just be hopeful and just listen, just when the time comes, just be serious. But before that, try to enjoy as well. And even when you're in step one, let's say you have a 6 month period in your time in your mind, and this is the 6 months I'm going to study. The first 3 months, take it easy. The first 3 months, study about whatever you're comfortable with. Don't burn yourself out earlier on. In your first 3 to 4 months, I personally, I was going out, I was meeting friends, and it always really helps if a close friend of yours or a close family member or somebody you know is also on the same boat as you, is also giving the steps. It really, really helps when you have somebody with whom you can just sit and bitch about the USMLEs and the process and the journey. It really helps when you have somebody to like just joke around with, to talk about the questions with, discuss the questions. Time goes by a lot more easily. So I would really suggest having a studying partner, at least for step one, not so much in step two, because at that point, you know what the system is like and you're familiar with the grind. So, but at least in step one, I would definitely recommend having a close friend of yours who's also in the same boat. Don't be secretive and stuff. Share things with them. Go on through this journey together. It's gonna make things I promise you, it's gonna make things a lot more easy. So yeah, that's what I would say. And you asked so many things,
yeah.
Muhammad Ansari. He said involved in step one and step two, research, publications, electives. Don't, 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 don't. You're man. You're like you're gonna burn out. You're gonna burn out if you start thinking about everything. Like I say, compartmentalize, prioritize. Your first thing is okay, step one. Take it one thing at a time. If you think about all these things together, electives, your search, step one, step two, relax. It's not that bad. People match. Like just take it easy. Start with like make your priorities straight, and it'll be a lot less. And electives is something that I think a lot of people have fun with that. So electives is not even something you should be worried about. Just like chill,
Yeah,
relax.
on that note, someone asked us that does elective, like doing an elective in government hospitals or private hospitals in your own home country, does that count?
Malaika Verdad. I want to know what you mean. Do you mean electives when you say government or private hospitals? Are you talking about your home country, like India,
Yeah,
Pakistan?
home country.
So, like, listen, I'll be very honest with you. To me, it seems like an elective from your home country is more or less all the same. Like, honestly, it does not really matter that much because people over here don't really. I mean, yeah, for like a really prominent program, maybe some of them know,
Yes.
some of them do, most of them don't. Honestly, most of them don't know about hospitals back home. But generally, some hospitals do stand out in your country. Like I know in Pakistan Aga Khan is a place that stands out internationally. If you're gonna get an elective over there, that's gonna help you a lot. And that's a private hospital. It's not even a government hospital. So it's all about which a hospital in your country has an international reputation. For a fact, I can say this in Pakistan, Aga Khan probably has the most stellar international reputation. So obviously, even though it's a private hospital, if you're getting to do something over there, that might help more so compared to any other place, even though that's a private hospital. In India, I think generally government hospitals are a lot better than private. I'm not sure. So I guess over there, just do an elective, try to do an elective at an institution that you know lots of people match from this program. Lots of people end up matching in the States from this hospital. And because you know they're going to have more of a PR over here, some good, a more better and appropriate PR over here in the US. So if you do a rotation over there, that's more likely to help you. But in the end, electives obviously matter a lot more when they're done here in the US. So yeah. Okay, Aisha Abdul Rashid. I consider myself an average student. Is it considered something that makes me anxious? Will I really be able to save lives one day? I've started studying on my own using better resources. Aisha, you are a good physician, you are a good person, and you are very mindful about your limitation, and that is very good. That there's nothing wrong with that. Don't doubt yourself too much. Listen, just be confident in yourself. Sorry, I didn't read the whole question. I might not do well in prof exam. I feel stuck between doing what's right for long-term learning and what's needed to just pass the exams. Listen, don't ever give an exam just for the sake of passing it. Whether it's in whether it's your USMLEs, whether it is your MBBS exams, don't ever give an exam just for the sake of passing it. That's not an attitude that will help you. Always give your exams. Always try to study whatever you're studying, whatever module it is. Keep in mind that this is one day the thing that might help me save a person's life, and then don't question your ability whether you will actually be able to save or not. If you're doing your part, if you're doing your due diligence, you are gonna, if you're not able to save 10 lives, at least even if you save one life that day, I promise you, you will feel so validated when you even saved one person, even if you weren't able to save nine other people. Don't doubt yourself. It's okay to be an average student. It's okay to be mediocre. There's nothing wrong with that. Most people are, okay? But the point is, if you just have a healthy outlook on it, if you just study with the intention that, hey, this clinical knowledge, what I'm studying now, might be the reason later on between life and death for somebody, that attitude will really, really help you. Don't go into your prof exams as well, just saying, I just got to pass this, try and do well, not to prove yourself to anybody else, not to be competitive with other people, but just for the sake that, hey, I might need this one day to save a person's life. And I promise you, your efforts never go in vain. Whatever efforts you put in first year, second year, I know it seems like you're going to be like, hey, what is the point right now? It will pay off one day, sooner or later. I sometimes even now my attending asks me a question, and I just vaguely recall it at the back of my mind. Hey, this was something in third year. I saw a TB patient in Pakistan, which is something unheard of over here. Nobody even knows how to treat TB over here. But oh, in Pakistan, we focus a lot about TB in third year, especially when you're doing pulmo rounds. And I remember that time thing came up, and I remember it from then, and I was able to answer, and it makes a good impression. So like, it will help you someday. Don't just pass the exams. Try to do well. Try to just set the bar up for yourself, not for anybody else. Don't and just don't get overwhelmed. Don't doubt yourself. Like, I know it's hard. It's easier said than done. Don't doubt yourself. Everybody says that. But just like, have faith in yourself, have faith in your God, have faith, and I promise you will get better. It seems really tough when you're just starting out, you're in second year. I promise you, as things move forward, there's a steep learning curve in medicine. Within months, you progress so dramatically, you won't even be able to recognize yourself when you're in third year or fourth year. You're going to be like, hey, I was so stressed about this in second year. So there's a steep learning curve. Don't worry about it. With time, it'll get better. Sorry, what's the next questions?
There's one that says, I'm still in high school and I feel lost and confused about the process of getting into med school. Can you give me some suggestions, please?
Lost and confused about the process. I don't understand what you feel lost and confused about the process, or like about your ability to get into med school. Like, I can't really tell you the process. I don't know where you are, what part of the world you're in. Can you give me a little bit of more context? What exactly are you feeling? In the meantime, I'll try to answer another question. Faniz Athar asks, does GPA matter in med school if one have to continue in their home country? Um, so I honestly, I had like the best GPA, like the third best in my graduating class, and it gave me no benefit whatsoever. Nobody ever asked me after I graduated, what was your GPA in med school? Nobody ever asked me, hey, did you graduate third in your class of 150 or whatever from Dow? Nobody ever asked me that. It it does not matter. Just your outlook on trying to do well, on trying to have good medical knowledge, that matters more. You don't have to fixate on a number. Um, sorry, I want to know about FCPS and I'm sorry, I'm not the person to answer this. I never thought about FCPS. There was one thing I knew early on, whether I was doing PLAB, whether I was doing AMC or USMLEs, I don't think I ever thought much about FCPS. I'm sorry, I can't answer that. Any suggestion on how to tackle subjects slash rotation that one struggles with? That one struggles with. Um, Clarify your concepts in it. Go dive deep. Like, if you're struggling with GI, for example, like, what part of GI are you struggling with? Is it the physiology aspect of it? Is it the anatomy, embryology? What is it? Dive deep. Go back to your basics, go back to your foundations, start from scratch, be open to like learning, and try to do questions. Questions really help clarify concepts. You can watch as many videos as you want. You can watch and read as many textbooks as you want, but until you open question banks and try to actually pay, that actually will give you a detailed report at the end that, hey, this is the part where you got the most questions wrong. You're not going to be able to exactly identify what part of this subject or module you're struggling with. Try to do a question bank, review your videos, review whatever, like, is it physiology of GI? Okay, I'm going to read all about the GI physiology, motilin, gastrokin, and all these things, all that good stuff. And then I'm going to do some questions on it. And I'm going to see if I'm grasping the concepts the way I should be. Getting back to Claire V. Samuel. I'm sorry if I'm not pronouncing that wrong, right? But it seems like I'm not too sure about your question, but one thing that will definitely help, whether like in both aspects, is killing one, like it's knocking out two things at once. It's like, if you try to do volunteering at a clinic or at a hospital in your hometown, in your home city, it's gonna help you realize if this is something you want to do medicine, and it seems like it might actually be medicine is something you want to do. But volunteering and having a good like extracurricular activity, especially that which is related to your field of medicine, trying to get into medicine, it's gonna help. It's never gonna hurt. volunteering looks good on your CV in the long run, even after med school. So try to volunteer at some local clinic, try to go to a hospital if you can, try to do an observership, even though you're not even a med student yet. I'm sure you can still find some hospital that wants you. You're in high school. Try to get into like street medicine projects. Those help a lot. Those help building your CV, and those help you just have a good bird eye view of what it is to be like in medicine, what it is to like help people who are underprivileged, who don't have a real voice. Try to get into volunteering projects like that. Try to get into street medicine in Pittsburgh. I don't know where you are in Pittsburgh. We have this thing called Operation Safety Net, which is a volunteering project for like anybody, whether you're a resident, you're a med student, you're a pre-med student, you're a high school student. You get to go and help in whatever capacity you can to like outreach, medicine outreach into your community. And that not only helps with you building your CV, but that also gives you some experience that makes you stand out. I promise you. And it gives your CV and it gives you as a person a more personal touch, more character, and more quality. And it just sheds a lot of light on medicine and the struggles that people face when it comes to medicine. So I would definitely recommend go out and volunteer with some community outreach medical program in whatever city you are at. Okay. What else, Zafira? Is there any other question I'm missing?
Um, no, not for now, but can you give any pointers for students who are just entering med school or applying to med school? Any sort of a disclaimer, hey, this is how your life will look like for the next 5 years?
Listen, I don't want to, there's no disclaimer. I don't like when people try to paint a very bleak picture about medicine is basically selling your soul to the devil. You're not going to have anything. I don't believe in that. It's all about your attitude. There's no disclaimer. It's all about, are you interested in it? If you are, if you're passionate about it, if you
That's
genuinely
true.
want to do, you will do well. No matter what, they could throw a rock at you, you could move mountains eventually. It's all about your attitude. Don't let people be paint doubt into your minds. Don't let people tell you, oh, it's super competitive, you're not going to have a chance. When I was in high school in like 10th grade or something, I had a guidance counselor whom, when I told him I want to do medicine, he's like, do you know how competitive it is? That is a stupid answer. That is the worst thing you could say to a medical aspirant. Don't ever think that way. Whatever, nothing good ever came easy. Whether you want to be like, if you're not going to do medicine, okay, you want to go into law, is that easy? Is it super like non-competitive to go in to be a good lawyer, to be a good, I don't know, businessman, or a good whatever, anything worthwhile takes time and takes effort. So don't let people like push you down or just demotivate you before you even start the process. So just have a positive outlook. And if you're passionate about it, if it's something you want to do and not something you're doing for the sake of somebody else, somebody's expectations of you, whether it's family or otherwise, don't do it for that. Don't do medicine for that, because you will have to eventually look after people's lives. You have people's lives in your hands. Don't do it just because somebody wants you to do it. But if you want to do it, if you're passionate about it, you can be very prosperous in it. I promise you.
Yeah.
It's not impossible to do. It's not rocket science. There's far more difficult things out there. I promise you, medicine is not the toughest thing in the world.
Yeah, I agree with you. All right, one last question. I know medicine is a never-ending field of learning, but when can you say you have enough basic knowledge?
Uh, when can you say you have enough basic knowledge? Like, I guess when you're so like this is a kind of a loaded question, but for me, I would say I have enough basic knowledge when I look at somebody and I can say, hey, this is somebody I can refer a family member to. This is a physician I can refer a family member to. Or this person has what it takes to one day be a physician that I can refer my family member to. It's not just about basic knowledge or medical knowledge, it's about your attitude. It's about your willingness and your commitment to helping people, because that's what medicine is in essence. So that's when I would say you have enough basic knowledge. I don't know, but like, what do you mean, like basic knowledge to give step one, or like just medicine as a field in general? I would say you have enough basic knowledge when you're comfortable in saying, hey, I can refer this person to a close family member of mine. And if you're a person who has very bad medical knowledge, I'll refer members that I don't. I'll be like,
Yeah.
going and somewhere that I would like to refer to you. So yeah, when you're comfortable saying that, that's when I'd say you have good basic knowledge, I guess.
All right. We won't be taking any more questions. Thank you so much, Dr. Muhammad, for sharing your journey and insights with us. Your
Good.
dedication to both academic and excellence in serving to underserved communities is truly inspiring.
Thank you.
Thank you for this talk. I'm sure many people took away valuable pointers from it, and we're glad that your pager didn't go off
Yeah,
on a
I
sad note.
I am too. Thank you guys. So I can just leave right now. Is that okay?
Yeah, yeah. Thank you so much.
All
It
right.
was glad. It was
You.
great having you.
Thank you guys. Bye bye. Have a nice day.